Hello, I welcome you to study session 15 of NSC 201, which will discuss components of vital signs. Moving to the introduction, health assessment is vital to monitoring the progress made by patients as well as establishing whether identified needs have been met. In health assessment, the measurement of vital signs appears to be a regular and essential feature. Hence, this unit is dedicated to discussing vital signs with a view to enhancing nurses' technical skills in the art of assessing vital signs as well as deepening your theoretical knowledge base. The variations in temperature, pulse, respiration, and blood pressure, which is the vital signs, give nurses and doctors their most important clues to the state of the body's function. At the end of this study session, you should be able to define vital signs and highlight its components. You should be able to describe body temperature and highlight the sites for assessing temperature. You should be able to explain and describe the mechanisms of respiration, define pulse and the factors that affect pulse, and should be able to explain the determinants of blood pressure and factors that influence blood pressure. What are vital signs? Vital signs are cardinal signs as which could be defined as signs reflecting the body's physiological state, which are governed by body's vital organs like the brain, the heart, the lungs, and necessary for sustaining life. It helps us to know if the body is actually healthy. Consequently, temperature, pulse, respiration, and blood pressure are referred to as vital signs because they are indicators of vital functions of the body that are necessary to sustain life. There are times to assess vital signs. You assess vital signs as a nurse on admission to obtain the baseline data. You can also assess vital signs when the patient or client's general condition changes. You can assess vital signs before and after surgery or an invasive diagnostic procedure. You can do it before or after administration of certain medication. You can do it before and after nursing intervention, and when the patient reports non-specific symptoms of physical distress such as feeling funny or different, you can assess their vital signs. Body temperature. Temperature is defined as a state of heat or coldness within a substance which can be measured against a standard scale of degree centigrade or degree Fahrenheit. Besides, there are two kinds of body temperature. We have the core body temperature and the surface body temperature. The core body temperature is the temperature of the deep tissues such as the cranium, thorax, abdominal cavity, and pelvic region. It remains relatively constant, while the surface temperature is the temperature of the skin, the subcutaneous tissue, and fat. It is by contrast rises and falls in response to the environment. The normal core body temperature is a range of temperatures fluctuating between 36.1 degrees centigrade and 37.2 degrees centigrade. What are the factors that influence body temperature? We can have age, can influence body temperature, diurnal variations, exercises, hormones, stress, and environment. There are common sites of obtaining temperature. We can have the oral, the rectal, axillary, and the tympanic membrane. Let's move to respiration. It is the act of breathing. It involves different processes. External respiration, which is the exchange of gases between an organism and its environment, and internal respiration or tissue respiration, which is the interchange of these same gases between the circulating blood cells and the body tissue. Human survival depends on ability of oxygen to reach body cells and carbon dioxide to be removed from the body cell. The body performs this heroic function via respiration. Regulation of breathing. This automatic control is regulated by respiratory centers in the medulla oblongata and the pons of the brain, and chemoreceptors located centrally in the medulla and peripherally in the carotid and aortic bodies. Normal breathing is accomplished by the downward and upward movement of the diaphragm to lengthen or shorten the chest cavity, and the elevation and depression of the ribs to increase and decrease the anterior posterior diameter of the chest cavity. These cavities are sensitive to amounts of CO2, pH, and low level of oxygen, which is hypoxia. Consequently, they respond to changes in the concentration of oxygen and carbon dioxide and hydrogen ion in the arterial blood. The elevation in the carbon dioxide pressure of arterial blood causes the respiratory center to increase the respiratory rate and the depth of breathing. This increased ventilatory effort removes excess carbon dioxide during exhalation. Similarly, if the arterial oxygen level falls, the chemoreceptor signals the respiratory center to increase the rate and the depth of ventilation. Breathing that is normal in rate and depth is called apnea, while respiratory rates have, however, been observed to vary considerably in elderly people. The rate varies with age, which tends to drop as a person grows older. There are some factors that influence respiratory rate. We have exercises, body position, emotion, stress, diseases, certain drugs, acute pain, fever, cold, increased altitude, and smoking. Pulse. Pulse represents the tactile arterial palpation of the heartbeat by trained fingertips. It is equivalent to measuring the heart rate, and the heart rate can also be measured by listening to the heartbeat directly, traditionally using a stethoscope and counting it for a minute. The study of the pulse is known as phygmology. The pulse can be palpated in any place that allows an artery to be compressed against a bone, such as the neck, which is the carotid artery, on the inside of the elbow, which is the brachial artery, on the wrist, which is the radial artery, and the groin, the femoral artery. We can also check the pulse using the popliteal artery, which is behind the knee. We can use near the ankle joint, which is the posterior tibial artery, and you can check it on the foot, which is the dorsalis pedis artery. There are some factors affecting pulse. We have age, gender, fever, medications, hypovolemia, stress, position changes, and pathology. How do we assess pulse? In assessing pulse, the nurse is not just interested in the rate but the rhythm, volume, and tension as well. The rate talks about how many counts per minute. You have to prepare your client, you inform the client and explain the procedure to the client. You palpate and count pulse. Place the first 2 or 3 fingers lightly and squarely over the medial aspect of the wrist, just above the base of the thumb. Using a thumb is contraindicated because the thumb has a pulse that the nurse could mistake for a client's pulse. The most important thing when you check your pulse, you make sure you document and report pertinent assessments. Blood pressure. Blood pressure is a force that is exerted by the blood against the walls of the vessels that carry it, and it is measured by an instrument called sphygmomanometer. In other words, BP is a product of cardiac output and total peripheral resistance. BP is highest during ventricular contraction, and this is systolic pressure, that is the pressure of the height of the blood wave. The pressure diminishes as the heart relaxes and is lowest when the heart is relaxed before it begins to contract again. This, which is diastolic pressure, that is the pressure when the ventricles are at rest. Blood pressure is measured in millimeters of mercury and is recorded as fraction, where you have the systolic up and the diastolic below. The diastolic pressure is the lower pressure that is present at all times within the arteries, and the difference between these two readings, that is the difference between systolic and the diastolic, is known as pulse pressure. BP can either be high or low. From your screen, you can see that high BP is from 140/90 and above, while the pre-high BP is between 121 to 139 mm of mercury, and then 81 to 89 mm of mercury. Then the normal should be between 120-80 mm of mercury or less. There are some determinants of blood pressure. 1. The pumping action of the heart. When the pumping action of the heart is strong, the volume of blood pumped into circulation tends to increase with corresponding increase in BP and vice versa. We have the peripheral vascular resistance. The higher the peripheral vascular resistance, the higher the blood pressure. Then the blood volume. The smaller the blood volume, the lower the blood pressure, and the greater the blood volume, the higher the blood pressure. The blood viscosity. In viscous, that is the thick fluid, there's a great deal of friction among the molecules as they slide by each other, and this explains why BP is higher when the blood is highly viscous. What are the factors that influence blood pressure? You can have age, exercise, stress, race, gender, drugs, obesity, and diseases. How do we assess blood pressure? First, you assess the patient's knowledge of the procedure and you explain the procedure as necessary. You ensure that the patient is in a resting, comfortable position. If a comparison between lying and standing blood pressure is required, the lying recording should be done first. When applying the cuff, no clothing should be underneath, as you can see on your screen. Because clothing can constrict the arm, you have to remove the clothing from the arm before you apply your cuff. You apply the cuff so that the center of the bladder is over the brachial artery, which should be about 2 to 3 centimeters above the antecubital fossa. The arm should be positioned such that the cuff is level with the heart and may be more comfortable resting on a pillow. The sphygmomanometer should be placed on a firm surface facing you with the center of the mercury column at eye level. Then you connect the cuff tubing to the sphygmomanometer. You locate the radial pulse, squeeze the bulb slowly to inflate the cuff while still feeling the pulse. You observe the mercury column and note the level when the pulse can no longer be felt. You unscrew the valve and quickly release the pressure in the cuff. You palpate the brachial artery, which is located on the medial aspect of the antecubital fossa. You place the diaphragm of your stethoscope over the artery and hold it in place with your thumb while using your fingers to support the patient's elbow. You position yourself so that the column of mercury in the sphygmomanometer is clearly visible, and you ensure that the valve on the bulb is closed firmly and not too tightly. Also, while observing the level of mercury as it falls, you listen for the chorus cough, that is the thudding sound, which is the sudden appearance of a sharp click sound, which increases in intensity and duration until it reaches a peak, then suddenly becomes muffled and less intense after a further fall of about 5 mm of mercury. The systolic pressure is the level where this is first heard. The diastolic pressure is the level where the sounds disappear. Once the sounds have disappeared, you open the valve fully to completely deflate the cuff and remove it from the patient's arm. Then, most importantly, don't always forget to document your findings. Thanks for listening. Bye.